It's time. And I'd be forgiven for saying that Johnny Cash joins me in the studio today, the man in black. How are you? Huh? Jimmy Cash. We could call you Jimmy Cash.
I'm walking the line of that, Jerry.
Are you walking the line, James? All right, well, we'll get down to business. It's good to see you, James.
Good to see you, Jerry.
Lovely, Hurling. So it's a regular programme. Last month we specialised. We had our friend in to talk about...
Correct, and we got a big
slimming-
response on that,
Yes,
Jerry.
absolutely.
And thanks to everybody for listening in. It was fantastic, and thank you to Sharon as well.
Absolutely,
It was
Sharon
really
was
good.
very informative. All right, James Geraghty. Good morning, Jerry and James. I'm a 66-year-old female. I'm on L-Troxin, Bicep, Telmisartan, I hope, Cadulus, calcium, all from the GP. I take one pure magnesium biglycerinate at night, but have terrible aching legs and arms, being wakened at night with legs and weight going on in arms and legs. Can you recommend anything to help me? God, there's a lot going on there, James.
So there's a bit of stuff there, Jerry, happening, and if we look at exactly what the GP is prescribing there, so the lady is on Altroxin obviously for a thyroid issue, and then we have the Bizup and Telmisartan, which is for blood pressure, and then we have the Catalyst and calcium, which would be for bone function. And the lady herself is taking the magnesium bisglycinate, which would be usually used for sleep at night. The bisglycinate can cross the blood-brain barrier, so it's quite effective at promoting a good sleep. But the aching arms and legs, I would be definitely suggesting there maybe a hydration drink for about a week. Yeah. So one of the neurons, Airlight is very good, Diorolite, and just take it during the day for about a week and just leave it then, yeah? And then go on to a little course of vitamin B complex and magnesium citrate, not the bisglycinate, but the citrate, and she takes that in the morning. There's no reason why she can't take the citrate in the morning, the magnesium citrate, and the magnesium bisglycinate in the evening.
Okay.
And I think that will definitely help that lady.
And James, those products you mentioned, all available from a chemist?
All available in chemist and a health food store. Very safe, very effective. And what you need to be doing is once she finishes the little hydration drink, if she pops into her pharmacy or health food store, she'll be able to collect one of those. And then ultimately, going on the magnesium citrate, she could do maybe 250 to 500 milligrams in the morning, along with a vitamin B complex. And if she could use them then, say, for about 4 to 8 weeks, I think we should get an improvement there.
Perfect. Okay. I want to know if there are natural products to treat inflammation in the joints, this caller asks.
The best one that I'm hearing at the moment, I was only talking to a gentleman this morning at the swimming pool, Jerry, and he's getting great results from a product called Benefits Osteoflex. Yeah. Now that's full of boswellia, collagen, hyaluronic acid, and turmeric. Good combination there. It'll just help reduce the inflammation, and it'll also lead to a little bit of cushioning within the joint. So the Benefits Osteoflex I find is very, very effective.
How do you take that?
Just 1 or 2 a day.
Tablet.
Little capsule.
Little
yeah.
capsule. Okay. Question for James. I recently had bloods done. My hemoglobin is 13.4, but my transferrin sat is 7%. Does this mean I'm low in iron? I feel tired. My RBC is high at 5.1 and creatinine is low at 39. I'm a lady in my early 50s. Can you explain this, James? Thanks a million. I hope you can, James, because there is a lot there.
Yes, there is, Jar. Now, the hemoglobin at 13.4 is not bad. Yeah. Sometimes in ladies, I like to see it a little higher, but it's within the normal. It's in the lower range of normal.
Right.
Her transferrin is low, the transferrin saturation rate at 7%.
What is transferrin, James?
Transferrin is part of the whole RBC, Jerry, where it combines with the iron to actually move it through the blood system.
Okay.
Okay.
Yeah.
So ultimately, what we're looking at here is the red blood cell count is 5.1. What I would like to suggest to that lady is a little bit of vitamin C. Yeah. And the reason I say that is vitamin C is very effective. We go with the ester C, Jerry. Ester C is absorbed very, very effectively. But vitamin C is really effective at bringing across iron into the actual bloodstream.
Very
okay.
good, yeah.
So using a little bit of extra iron there, I think, would make a significant difference to that lady. Although sometimes, even taking a supplement, and I would always be wary of taking supplements because sometimes people can get constipation or can get upset tummy. So have a chat with the pharmacist in relation to the best ones that can actually that will actually suit you.
What's creatinine?
Creatinine. So if you look at creatinine, Jerry, you ever hear of creatinine? So there's creatine and then there's creatinine clearance. So it's basically a measure of how functionable the whole kidney area is.
Okay.
Okay. So, but ultimately it's a little low there, but that's not too bad.
Okay,
I wouldn't be
yeah.
actually worrying about that. 39 is not bad. But what I would say is, just in relation to that, the lady's in her early 50s. If she can take, say, some vitamin C, and even the creatine there may be a suggestion that she might be losing a little bit of muscle mass. So it might be a consideration there, maybe to pop to her physiotherapist, have a little chat with her, and just see what they're thinking in relation to that.
My 20-year-old daughter is constantly tired and gets iron injections maybe twice a year. She's had investigations and nothing has been found as the cause of the low iron. Is there anything that she can take or get that will help with this tiredness?
Well, as a 20-year-old, Jerry, what we're looking at here is, again, if we're referring back to the last previous question in relation to iron, I would definitely recommend some, in this case, lipospheric vitamin C. So that's lipospheric vitamin C, and the reason for that is that the lipospheric vitamin C in this particular case would get absorbed a lot quicker. I definitely suggest as well for the 20-year-old a multivitamin for a period of maybe about 2 to 3 months. So along with, say, Energy Plus, along with a lipospheric vitamin C sachet, they usually come in, or you can get them in a liquid now, just using that for a period of about 2 to 3 months. Because if you look there, Jerry, the patient is getting the iron injection twice a year.
Yeah.
So sometimes you'll get your injection, but then if it's running down all the time, it's decreasing right to the period till they get the next injection. So the key here was, how do we actually improve that we can keep the iron levels at a higher level over that period of time? So the trick there would be a good multivitamin, maybe with a little bit of iron and some lipospheric vitamin C.
And see what happens.
Absolutely.
All right. Now then, can you ask James, I have what I think is a tonsil stone. It looks like a yellow spot of pus on my throat. How can I get rid of it? Or do I need to see a doctor? Never heard of a tonsil stone, James.
I never heard of a tonsil stone, but what I think they're referring to there, Jerry, sometimes I often see when people come in and they find it really difficult to swallow. And if you look, they have a big swelling just in the throat there.
And you sometimes will see white pus
yes,
on
and
the
you look
tonsil.
really raw, and I'd be saying doctor straight away.
Okay.
Needs to make an appointment there with the GP. If they are struggling, pop into the pharmacist and maybe get something to soothe the throat area. But ultimately, what we are looking at there is an issue where there's a possible infection in the throat area, and the GP would need to see that.
For a specific antibiotic.
Absolutely,
Okay.
absolutely. Yeah.
Good afternoon, lads. I have either arthritis or sciatica, plus 14 and 15 problems. Would I have had physio before? No good. Waiting to see a rheumatologist. Would James recommend deep tissue massage, or what does he think? Thanks, as Thomas. Now, when they talk about 14 and 15, is that in the spine, James? They're talking about those.
I'm unsure, Jared, to be honest. What are you thinking there? Plus 14 and 15 problem. I'm unsure.
The number.
Yes, Jared. But that to me would be a little bit high up the back there for that.
Okay.
But what I am looking at there is the sciatica is usually coming from the lower back or the sciatic nerve, and arthritis would be unsure. But ultimately, there, what you'd be needing to do is to make a differential diagnosis, as in what exactly is going on.
Exactly wrong.
Yeah. Like obviously they've gone to the physio, and that's not doing any good. And they're waiting to see a rheumatologist, which would be very, very important. Like the likes of deep tissue massage would probably offer some short-term relief, and even if they went on some of the Osteoflex, which we discussed briefly, that may give short-term relief. But fundamentally, if it is a rheumatology or arthritic problem, rheumatoid arthritis, ultimately that will need medical intervention, and it'll need a rheumatologist to decide. And with the newer biologics that are coming out nowadays, say for example Humira, people are getting really, really good results in relation to calming that effect in relation to rheumatoid arthritis.
That is good to hear, because people did suffer.
Absolutely.
Question for James. I've had psoriasis for years, but lately getting flare-ups very bad at the moment and itchy. I'm using Dermavate, but it doesn't seem to be working. Thank you.
Okay, well, psoriasis, as we know, Jared, it's an autoimmune issue, and it can just flare up out of the blue. Just some people can get this red irritating rashes along affected areas. The fact that they're getting itch and they're using Dermavate. Now, Dermavate is a very powerful steroid, and I wouldn't be using that for a long period of time. They need to discuss that with their GP if they're using it on a long-term period. But it's important that they use lots of moisturizers, really good neutral moisturizers, to keep that particular area, that they keep them moisturized. The Dermavate, by its very nature, will reduce down the itching, but it can thin the skin over a long period of time. But definitely the need to look. Say, for example, what I would recommend there, say for about 8 weeks, would be something like a bit of its liver detox. right? One capsule a day for about 8 weeks. Just clear out the system, okay? Is there something within the system that they've taken over a period of time that might be causing this irritation? Because sometimes even stress can cause the problem.
Of course,
Ger.
yeah.
And go on a good course of vitamin D for the next 2 months.
Pardon
Just
me.
on that, Ger, maybe about 3,500 I use.
Pardon me. So I'm just wondering, checking with James, if you're having a hip operation, should one take something a few weeks before it so that healing can be easier? No, I'm fine, thanks, asks Pat. So if you're having a hip, you are the question. You're all right.
Yes, I
Okay,
am, Ger.
perfect.
I personally, and this is we have seen it here before, Ger, where we've recommended for people to go on protein powder. They can pop into their pharmacy or health food store and get a tub of protein, their favourite flavour, whether it's strawberry, vanilla, and take a couple of scoops of that, along with an ester C tablet for 4 weeks before and 4 weeks after the operation. And just stop it a day or two before you go in and restart it when you come back out of the hospital.
And that should help.
it is very good. And the clinical data is there to show, Ger, that higher protein diets pre and post-op increase clinically recovery by a significant percentage.
Perfect. Now, the next one is vague, James. How should I treat a pain in my knee? It's vague,
That's
I know.
vague,
It is
sure.
vague,
You know, look, if the person has an ongoing pain in their knee, you know, they can, if they're a young person, you know, popping into the pharmacist and having a chat, maybe getting some short-term anti-inflammatories, the likes of ibuprofen and some paracetamol for a short period of time, and see does that reduce it. If it's more long-term and they're getting pain when they're standing up, or they're getting real bad irritation, and they're feeling a lot like the bones are grating against each other, that they will need to go to their GP and get it reviewed, because they may need an X-ray and MRI. And just on that, Ger, I recently had an MRI in my left knee, Ger, because actually when I'm swimming, and sometimes I wear support now, but when I'm swimming, when I get out, my left knee would be really sore, and I was thinking, Jesus, there's a problem here. But when I looked at it and did the MRI and the radiologist looked at it, it's just normal wear and tear, but nothing to be worried about. Yeah. So ultimately, what I did do was I got a physiotherapist to look at it, and we got some work done on what's called the T-band around the affected area. Made a fantastic job. But the key in all of that was getting the MRI done. So ultimately, I'll be saying to that person they need to be talking to their GP ultimately. Or if they can't get to the GP in time, get a couple of anti-inflammatories, have a chat with the pharmacist and see where we can go from there.
Lovely. So one more now before the break, and this is about advice on poor circulation. Would you have any advice about poor or on poor circulation?
Well, sometimes, Ger, poor circulation can be down to issues in relation to, well, it could be obesity, overweight, diabetes, so we need to be very careful there. But ultimately, you know, a couple of things that could help, Ger, would be, number one, stockings, class 1 stockings. If they pop into the pharmacist, they can get measured for them. And then the other thing would be maybe taking a little bit of magnesium and vitamin B complex just for a month or two, and just to help promote in relation to getting the blood going. But the support stockings are very, very effective, but they will need to be measured for them.
Perfect. So therefore you need to get your advice from the pharmacist.
Pop into the pharmacist.
From the team at the pharmacy. All right. Okay, so that's where we leave it now for the moment. We'll take a break. I'd say at this stage we have more than enough questions to be getting on with. Thank you for them. We'll answer more after these.
Sure.
Morning show on Midwest Radio, thanks to Harrington
Lovely
Concrete
job,
and Quarries.
No.
Can I talk?
You can? Oh, sorry. Hold a second now.
Systems designed to protect and safeguard our environment and water quality. Harrington Concrete tanks, wastewater treatment tanks and tertiary systems designed to protect and save.
Welcome back to us. Now, before we go back to answering questions, a couple of things. Number one, you're telling me this April is IBS month. Is that right?
It is, Ger. And the reason I became aware of that was I was talking to a lovely lady yesterday in one of her stores, and I just popped out to her with a prescription, and she just said she'd like a little word with me. And she looked just a little bit nervous, shall we say. And we went in and we were having a chat, but she just mentioned she went in into one of the hospitals, and she was looking at getting a little, one of the surgeons maybe just have a look at something on her face or whatever. Anyway, by the time she got in there, the surgeon looked, and within 10 minutes she was down on an operating table, having a big operation on her face. And as I thought myself, she looked and felt rattled. She was not sleeping. She was run down. You know, she'd been obviously given a diagnosis that she had, a form of cancer, melanoma, and obviously that was removed. And, I suppose that was the positive starting point, that it wasn't closed and whatever. But I think I was the first person that she talked to it about it, and what I would say to people, if they get in that situation, call in to the pharmacy if you can't get to see your GP and have a chat. Pharmacists, we listen to stories like this a lot.
Sure.
And sometimes it's worth just calling in and having that conversation, and it can take a little bit of pressure and weight off the shoulders of the patient.
And that's for anything,
Absolutely,
Any
absolutely,
kind of we started talking about IBS, but it can
totally.
be anything.
And it just happened she mentioned that she was feeling a bit run down, so I sorted out with tonic, but we got talking anyway, and she was mentioning that she had a bit of problems with running to the loo and whatever.
Okay.
It sounded very much like IBS, and when I was doing a little bit of work on it last night, I noticed that it was actually April is IBS Awareness Month.
Okay.
So if people are struggling a little bit with IBS, pop into the pharmacy or health food stores, some super supplements there to help with the gut, Jerry, whether it's peppermint or the Benefits Bowel Support sachets. Like, for example, with that lady yesterday, I gave her 5 or 6 sachets. She can take a sachet every couple of 2 or 3 days, and we're going to look and see, will that calm down the gut?
Yeah.
So the key with IBS is the frequency of issues, whether it's constipation or diarrhea. So you want to spread them out, as in, rather than happening every week, that might happen maybe once a month, and get it out there till that's only happening a couple of times a year.
Good.
And that's how the best way to manage that in. So popping in, having the chat with the pharmacist, getting a couple of natural products, peppermint solution, peppermint capsules, the Benefits Bowel Support, really safe, really effective, very natural at supporting gut function.
Okay, back to the questions. Thank you, by the way.
No problem.
So,
well, just on that, Ger, that lovely lady, she's giving me a call in 2 or 3 weeks' time to see how she's doing.
Lovely,
All right.
lovely. Now, caller has a persistent problem with continuous build-up of phlegm in the back of my throat. I've tried everything, and I've had this problem since Christmas. At night time, particularly, it continues to flow. Can you advise?
I would suggest to that lady, did it say, Ger, is it a male or female?
It doesn't say.
And then any medication?
It doesn't say either. Just the condition phlegm, build-up of phlegm in the back of the throat.
Okay,
James.
if they have phlegm at the back of the throat, usually what I'd recommend is a carbocystine bottle, Ger. If they pop into a pharmacy, they'll be able to get that. It usually comes under Viscolex or Expitex. But I would take it along with some propolis cough bottle. Okay, so a spoon of each 3 or 4 times a day, and it should make a big difference to them. And maybe if they have a drip at the back of the throat, sometimes at night time you can get this drip going down into the back of the throat, and they could use maybe something like a Zyrtec Plus 1 a day for about 4 or 5 days. Now I know there's an antihistamine in it, but for some reason the antihistamine and the pseudoephedrine, it's a slow release preparation, but it seems to dry up issues around postnasal drip. And if you can help with that and just take your little bottle, your propolis spoonful 3 times a day, along with your Viscolex or Expitex, a spoonful 3 times a day, it makes a big difference.
James, I was in hospital for nearly a week in February having pleurisy, pneumonia and COVID. I was on antibiotics for about 6 weeks and taking probiotics now and iron as my levels were low. Is there something else that I should be doing or taking for my lungs to keep them healthy and strong? I'm female, I'm in my early 70s.
Just have a little look at that again, Ger. She was through the mill there, wasn't she?
Yeah, so the month of February, pleurisy, pneumonia and COVID. Was on antibiotics for about 6 weeks and taking probiotics now and iron as our levels were low. Is there something else that I should be taking or taking for my lungs to keep them healthy and strong? Female, early 70s.
Well, we don't know what medication she's on, Ger, or she released on any medication, but my view there is that she would be well rattled, as I used previously, Ger, if she's been on the pleurisy and pneumonia and COVID at the same time. And I'd definitely get a good strong multivitamin there for about at least 3 months. You know, you could either look at the Revive sachets, the Energy Plus capsules. You know, you have the female multiple from Solgar as well. Very, very good, very safe, very effective, but it should give her a lift there. The lungs by themselves, Ger, I would definitely think it'd be worth having a chat there with a specialist physio.
Okay.
You know, in relation to lung function, how to breathe, you know, breathing deep down into the lung rather than just breathing
Shallow breathing.
Shallow breathing, Ger, because that would make a definite difference. There is a particular instrument you can get, Ger, that helps strengthen the lungs. I have 2 of them, and what I'll do is next month I will actually bring in one and I'll show you how to use it. But it is very safe and it's very effective, and it just puts a little bit of pressure on the lungs when you're breathing out, but it does strengthen them up. But if that lady was local, and we maybe might get her to call in her number, and I'll give her a buzz and I'll give her a demonstration and we'll go through it together and we see can we help that. I think it's called a Neurospace Haler, and there's no medicines or anything in it, but it's just a physical device that you blow into, but it actually helps strengthen your lungs.
That's good news.
Yes.
Hi, I had the shingles 7 weeks ago. Now I have this horrible nerve pain, which is the best. What is the best treatment for it? Thank you in advance.
Well,
Shingles.
we've been down
Yes,
this road
many
before,
times,
Ger.
yeah.
And the most important thing here for that, and it's a very good question, is with shingles, the nerve lining, the myelin sheath is damaged, and what we need to do is help this patient get that rebuilt and ease down that pain. Now, the treatment for shingles is very effective. It will kill the virus, but it will not help repair the damage, and this gives rise to post-shingle pain that can be right down, you know, 1, 2, 3 years post the issue arising. The key here is vitamin B complex and omega-3. Okay, if the patient pops into the pharmacy or the health food store and asks for vitamin B complex and omega-3, either the capsules or the liquid, and go on that for a good period of 2 to 3 months, it'll have a really big impact on, number one, diminishing the pain and that post-viral pain that they're experiencing, but it'll also help improve the underlying issue, which is to improve the healing of the myelin sheath.
All right, now on to this caller. Lipitor or atorvastatin pinewood tablets. You gave us a name for a new tablet some weeks back instead. Can we have the name of that and where it can be got, please?
Well, I don't know, did we give a new tablet, Ger? I mean, usually what we recommend there, what you can take in relation to the atorvastatin, is the resveratrol.
Okay.
Yeah. And that can be taken in conjunction with the statins, and it's quite effective helping lowering and supporting the lowering of the cholesterol, both the total cholesterol and the bad cholesterol. In fact, Ger, I was talking to a gentleman yesterday, and he had a fantastic story for me. His cholesterol, total cholesterol, dropped from 8 down to 5.2, and he was on a statin, and we put him on some of the resveratrol along with multi-fiber plus. So we had lots of fiber in the gut, and the fiber in the gut is a great filter for not allowing bad, sugary, processed, all of that type of food into the system. So he was taking that, and over a period of 6 months, he dropped 3 points.
Wow.
So there's no reason why that person, the resveratrol is the one that I'm suggesting we talk to. There are different forms of statins, like rosuvastatin is a newer one. But again, you can take your resveratrol along with that.
Okay, so this person's on the Lipitor or the atorvastatin, which is prescribed.
Absolutely, Ger. And they can take the and again, what I would say to that person is, if you decide to go on the resveratrol, Jerry, or even taking extra fiber in your diet, make sure you talk to your doctor in 3 or 4 months' time, because you don't want your cholesterol to go too low.
Okay, so we have 2 minutes and 2 questions for this section. I'm a lady in my late 40s, and I'm diagnosed with chronic pain and fibromyalgia, and I'm wondering if there's any tips for pain in the right shoulder. I'm already on a load of medication at the moment.
Well, the only one that I could recommend for that, Ger, that I could feel that wouldn't have any issues around side effects or drug interactions would be Benefit's Osteoflex. And I would strongly recommend deep tissue massage at a gentle level with a specialist masseuse, to help ease down that irritation in that affected area.
Lovely. My husband in his late 70s, and his iron is very low. He took 3 bottles of iron and is still low. Is there anything you can recommend?
Needs to take it with vitamin C, Ger.
So
he needs to take it ester C or lipospheric vitamin C.
That's the one you mentioned.
Take it over 3 to 4 months, and that should lead to a good improvement.
Perfect. Now, this is where we end this section, the live section on FM on the local radio. Again, it's 096 60072 if you'd like to make contact with James and his team. Thank you for the questions. Those that we didn't get to, we're going to answer those now on the Facebook page, and that'll be up on our Facebook, and it'll be up on James's Facebook, Malloy's Pharmacy Facebook page in about an hour's time. Thanks to the team. Thanks to Sarah. Back doing the regular show tomorrow.
The Mid-Morning Show on Midwest Radio.
Lovely.
Thanks to Harrington Concrete and Quarries, producers of high-strength cattle slats, beams and manholes for the agricultural sector. HarringtonConcrete.ie. Concrete building.